everyone, today we will be discussing diabetes type 2 and how it affects your life. 1 in every 5 people who are above 65 years old is living with diabetes. This disease has caused around 4.2 million deaths in the year 2019. So now that I grabbed your attention with big numbers, let's talk about the disease in more depth. Type 2 diabetes is the most common type of diabetes. Among all the people living with the disease, 90 to 95% have type 2. So what is it? Short answer is a chronic disease that is described as having high blood sugar due to your body not responding to insulin. But we care about the long, more detailed answer. In normal bodies, the pancreas releases the hormone insulin that binds into specific receptors on the cells to allow them to absorb glucose, aka blood sugar. However, in diabetic patients, the insulin does not bind into the receptors, hence preventing glucose absorption. That is what we call insulin resistance, that later can develop into diabetes if not cared for. The pancreas becomes fatigued due to it constantly producing insulin, yet the glucose remains high in the blood. If not managed, this will lead to furthermore complications. You will be up to 5 times more likely to get a heart disease or have a stroke. Over time, the glucose will damage the blood vessels and nerves, thus the organs they supply. This will result in vision problems, nerve damage, renal and cardiovascular diseases. These complications are called comorbidities. A comorbidity is the presence of one or more additional conditions with a primary condition, in this case type 2 diabetes. The most common comorbidities of diabetes are dyslipidemia, hypertension, and obesity. How are they related, you may ask? Dyslipidemia occurs when someone has abnormal levels of lipids or fat in their blood. Triglycerides, which is a type of lipids, develop when glucose is not burned right away and is stored in fat cells. People with high levels of triglycerides tend to have a higher risk of developing atherosclerosis, which is a buildup of fatty deposits called plaques. This restricts blood flow and causes hypertension as well. Now, for obesity, it's one of the most common complications and risk factors for diabetes. It's a bit confusing, but hear me out. Studies have shown that if you have high fat content, especially around your abdomen area, you are more likely to develop diabetes than normal BMI bodies. Abdominal fat causes fat cells to release pro-inflammatory chemicals, which can make the body insulin resistant and later develop type 2 diabetes. The glucose in your blood has to go somewhere, it can't stay in your bloodstream. Therefore, you either burn and use it as energy during exercise, or your body will take all of it and store it as body fat. That's why a lot of diabetic people are obese as well. It really is a direct relationship with diabetes and obesity. If one of them increases, the risk of the other does as well. Other risk factors are family history, inactivity, age, and polycystic ovary syndrome for women. So, how can you tell if you have diabetes? You will feel very thirsty, pee a lot, feel cranky, have blurry vision, fatigue, and worn out. Your wounds won't heal as fast and you'll feel tingling in your extremities. Nevertheless, these symptoms can be so mild that you do not even notice them. That's why it's better having a medical examination every once in a while. Moving on, type 2 diabetes does not have a cure, but can be managed and prevented. Some people can achieve their target blood sugar levels with diet and exercise alone. Physical activity burns both blood sugar and sugar stored in your muscles and liver. Aerobic exercise, such as running or any cardiac workout, can lower your blood sugar immediately. Resistance workout or weightlifting for a long time can affect your blood sugar levels many hours later. It's one of the many reasons why you should check your blood sugar with a glucometer after exercise and before going out. A normal blood sugar rate is less than 140 mg per deciliter. As a matter of fact, type 2 diabetes can be reversed. It's when glucose levels are below the diabetic range, meaning that you have it under control with no need of medications. Storing too much fat in the liver and pancreas prevents it from producing insulin and affects how type 2 diabetes develops. Losing this fat can help put your diabetes into remission, and the key is in starting as early as possible. You should keep refined carbs and sweets to minimum. Obviously, the last thing you need to do is add more sugar to your bloodstream. Keep a healthy diet and try to control your weight and do not overeat. If diet and exercise alone are not enough to manage your blood sugar, you may need prescribed diabetes medications, such as metformin, which lowers your blood sugar and insulin resistance, or insulin therapy or injections to compensate for the insufficient insulin and to help regulate your blood sugar. At the end, having a healthy lifestyle prevents many problems, as you can see. Pay attention to what your body tells you and don't be lazy.